Some 60% of Uganda's population is aged below 20 years. The country also has the second lowest median age globally and the highest child dependency ratio. Young and adolescent girls in Uganda face a myriad of socio-economic, health and cultural challenges. These challenges have a decisive impact on young Ugandan girls' ability to develop, accumulate human capital, and even exacerbate teen pregnancies and early motherhood. All of these factors combined can prove a powerful disincentive for Ugandan girls to reach their full potential, and even lead to a pathway for them to be subject to increased and risky behavior. The Empowerment and Livelihood for Adolescents program, ELA, is implemented by BRAC Uganda. The program is designed to improve the cognitive and non-cognitive skills of adolescent girls, offering vocational training for income generation and building knowledge and awareness for participants in their rights and choices pertaining to sex, marriage and reproduction.
BRAC Uganda, with support from UNFPA through our ELA program, has been able to reach out to over 55,000 adolescent girls in our previous years of operation, and that is in 32 districts across Uganda. We are currently working with 2,500 adolescent girls in the 7 districts of Karamoja, Inamuria, Kaberamaido and Kiriandongo. And in Kiriandongo, we focus both in the host community and the refugee settlement.
Here, it is a culture that a girl is supposed to be married off. To get a girl marrying off at the age of 25, it is really an insult because they say that is already an old woman. So girls marry here at the age of 14.
Before ELA reached this sub-count of ours, particularly this parish of Ajaki, we faced a challenge of girls getting pregnant. They could drop out of school. They produce without spacing children. They even feared staying in a community, most especially those ones who are on ARVs. They felt as if they were forgotten.
The situation was alarming. We had so many school dropout rates. Very many girls were getting pregnant. Very many girls were married off.
Previously, we have had youth that have been indulged in so many bad practices, especially in drug abuse, alcoholism. They have been always not respecting elders. They have not been respecting their leaders.
So as a district, when we received the BRAC, we were very happy because we knew at least we had an intervention in that area.
So the program basically focuses on adolescent girls out of school. So we look at those who have high prevalence of GBV, the girls who have a risk of teenage pregnancy, the girls who have dropped out of school, those who have children and those who do not have children.
BRAC's goals directly correlate with the United Nations Population Fund, UNFPA, Outcome 3, which seeks to enhance reproduction rights and services for all women and girls, enabling more choices with respect to early marriage and teen pregnancies. This goal is also an integral part of the Sustainable Development Goals and specifically SDG 5, which targets the elimination of all forms of discrimination against women.
When we look at ELA program, we are looking at adolescent girls 14 to 24 years. And we want to see that the girls are empowered with social skills so that they are able to make informed decisions on issues that affect their lives. The adolescent girls are mentored by one of them, whom we call a mentor. And the role of the mentor is, after BRAC has trained the mentor facilitates sessions, and the sessions are conducted from within the safe spaces.
In Iteso, we have 3,000 for 25 footsteps.
Yes.
I'm a mentor in ELA program. ELA works with girls who are on ARVs, who are living positive life, ELA deals with the school dropouts. ELA deals with single mothers. ELA deals with the orphans. But things ELA as a program has come, I'm seeing some change because they are now free with me. We can talk, we can laugh, we can share problems. It is because of this help of ELA implemented by BRAC.
Kakirurai Esther Akelo. Ashomenga tukoto na kanyitare kwenye mamnga bwa peda yataki ni somero. Mameti kapun chanekal. Nisai obwasho mani biro rori kwange. Aduko kina yango arako ngadit kartom na kanyare konya bunga auro iko kuyendidi. Uchono rai dari kokungin apa ai kilo kitida. Salakin dongo bonai pangai jar. Tonido na pupu nanga bunache vera imwa pesuro chalone. Be kota pesuro BRAC. Wadi kaun donga dalo maruriong tengone la BRAC. Wadi kaun ngo los dongo ngina. Shana kinodo sangina. Kiron ala nakina aur. Kiron we sen. Berono jai konai. Aduko kini diroki dit. Na chamu tingo da berono narai aditinga para sham. Alo madungo ngina. Budo vera bongo dai jeno obongo bere bala jengo do somero nare si chai ngibaro le puangina. Ne bakare be ijai implant. Ijai liki pills. Ne sabunge meda obera ngina. Sodi adekane se jai to soma condoms danen. Ayelo na mameyu wara. Nasidum naja adekane se.
Aranka rora abun Rosemary arkawni aka kokuyegen abu atoduar aranka kar matomono angkan kapei ani rikakin abu atashama ekile ani kashama ekile abu atopotiyo ani downi kwa abu ko kutotwan ani ngon maru anu peinugu ane downi ane potiori na boy kokuyegen abu ekile atongere ayo abu anga dang chane apoti ayong obonte abu anga to yane ke pitengolo ayare ayong aleji ayong abu achi ayong agu achi anga je atogelang lo ya kokwaye tamadi nyoni ngoni buno yo nyoni ngoni potiore yo kokweni tongere yo kile bati abu to kata make keria ayong buana kodhowan na pe yala ka bonga abu apaka na kodhowan ebo yayong kai toka ngisiada ekedhiburane wayong ala kale kodhi kai kokwen ngisiada ya totone yan kwanye siada da to bonga teme ay mo kana kariang ani ngoni radia yang program ne boko iburaka na gabu abu ayong agirakin na na program ngena abu ayong obo yanege pepe ngata meta una ngonde ka yakari ayong na kwana ka akadi pepe ayani ki pepe ngata mar ayai pepe klabulo lo boko ibrak nya tami piano woi ikwangna ngoni de ka tami ayong abashi ang katunga ngashina chie pediro tata mi aka ka toto ngulu shengul nyi kwa kidhineni tata mi atamar topolo mono anir ka kin tor ka ushie kile ngola ikiteni ako ni kiyar topolo paka ngekar ngatomoni are angkan kauni paka chotor ka ushie kile an chokwan ator ka ushie ko kwegen boyo pe kamaka anakodwana anege itao ngumwa nyedie yarreluwa.
Through our health forums, we work with CHPs, that is the community health promoters under the BRAC health program.
The knowledge that the young people have got has improved their life to prevent unnecessary pregnancies, to prevent the STIs, and we've seen that Even the HIV that was so prevalent amongst the young people, you hardly see a number of them.
And BRAC also comes in now with the economic empowerment, because with the curriculum we use, we have financial literacy, whereby the girls are taken through how to save, how they can plan, how to budget, how they can start their small-scale businesses. And with the synergy and integration and linkage to the government programs, we've seen also girls have been able to start small-scale businesses.
Nara saving kaka kuna kwatare moye ata inbonga kwatare ngine jaun nga kwatang na gwel dongo da sabuni yang bera plan kalo ngaren kaja taren ko kidope akoto tinga adum ne ponele togo gongoro ngesi asode ngo iconai ara ngadum ne kadu kala spokin nga gwela na reproduce ngona nga spoita ke jara ngare ponokora ke na nga kokore atomo akokorangu na atomo na bunge jula ka kesi arauni akine oure da kine ngene ikoko ke usaleta are ya gwela dong na gwel bongi pege da pisti bongo ngenda no jula kine ijaro ngare boroko munu kera dumuningo anajok sana BRAC.
When my parents died, they left me when I was young. I became a street girl and I stayed in the street for 4 years. Just begging some money. If I told that I see any foreigner who has a lot of money, I say, give me 100 shillings. So I come and use it for my sustenance. I sleep, tomorrow again I go back to the street. So since BRAC came, it has given me really good idea of selling a bit so that I get something I sell. I can sell even this one at 5,000. I save like 2,000. I use 3,000 for my family.
All of us know that gender-based violence majorly is caused by economic crisis. But now if the girls are able to access and start small-scale businesses, they are able to prevent issues of GBV, because then they have resources available, they can access money, they have funds, and they are able to meet their basic needs that would constrain their parents and husbands, that would result into gender-based violence.
My husband died last week. He left me with 2 children, a boy and a girl. So if I cope up with my business, that BRAC taught me. So I continue on how to stay with my children. My dream is to build up with my business. I get some income to educate my children first. I buy my personal land, then I build my own home.
The girls have been empowered. The girls are able to make informed decisions on issues that affect them. And that also we are able to achieve it by involving the parents of the adolescent girls through parenting dialogues and parents forum, so that the parents are able to support the girls during the process of puberty.
family planning nyara mtu ane pria ngara kini chindi na lapata kona anya ke kere ptelo ngara ntie ke ti so to kona munda akirim pria wana rim tingada mar be war kala ntie ko de wasi boy cha lapata kona la kala ra berna ke kala.
We also work with the police, family and protection units, and that strengthened our referral pathway.
We have been handling issues concerning GBV closely with BRAC. We have been handling issues concerning sexual reproductive health. We have been handling issues concerning alcoholism and drug abuse and sexual offenses. Just within 2 to 3 days, somebody killed their wife because of just food. Imagine, just food. The woman failed to prepare food in time. How do you take the life of somebody just because of food? Yeah? That's why you see we have decided as a district that let BRAC go and shape that area using those programs so that people can be really learning. That's why you see elders welcomed it very well. They are now like our ambassadors.
We also want to support the girls who are still within the school-going age to go back to school by identifying and dialoguing with their parents to embrace their roles, and we give them scholastic materials. So we've seen also about 99 girls in our previous work who have been able to go back to school, and they are able to achieve their formal education careers.
My name's Komal Joyce. I was impregnated from school. Of course, the guy who did the pregnancy ran away. He took off. I was 17 when I got pregnant. As I stopped my education because I was pregnant, I came home back to my parents. They were able to take care of me. So right now I'm coping up with life slowly with my mom. She's the one helping me be who I am today. Of course, I was planning to go back to school before the lockdown, but since the lockdown came, it affected my going back to school. And of course, my dream is to go back and begin from senior 2.
By the end of that day, we have seen that the girls have been empowered. They are not just driven into joining peer groups because they are informed. They know where to access whatever information they need. They know the different stakeholders that provide to them information.
So when we interacted with these girls, they are able to express themselves, and they are able to make choices to decide the right marriage partners.
I joined BRAC, and it has made me to know about family planning. It has given me time to space my children. And it has given me lessons on how to handle even my hygiene, like menstruation and gender-based violence.
Bora na joki kiberango. Ajata rango kediko kidope bon. Ka bunge sishane family planning. Uso do kwa no community. Arengo confident agogo ngare de buetu ngene nikona yago.
Currently, my wife and other girls that I see here do not quarrel with some of us. She's the beneficiary, but I am earning a lot out of BRAC. She used not to respect me. I used not to respect her. But when she comes and teaches me, sits me down, and tells me that this is how we should get along in this relationship, I don't fight with her. I understand her and she understands me.
And we've seen these girls acting as role models and mentoring other girls. And that has come in because their self-esteem has been built. They are now confident. And the girls have been able to even participate in leadership, not only within their communities, and have also, but also at sub-county levels and district levels. Another impact that we've seen from this ELA program is the involvement of their parents into the program has also changed the attitudes of these parents and also built their parenting skills. The parents know how to communicate to the adolescent girls. They know the challenges that the adolescent girls undergo during that stage, and so they are able to support the girls. Then we've also seen that through girls participating and accessing sexual reproductive health information and services, we've seen reduction in teenage pregnancy, we've seen reduction in forced marriages, and with gender-based violence, because the girls are able to access family planning services, they are able to know where to report who from, and so we've seen that the community now appreciate and have respect for the girls.
We saw it was a very good project for that will help us to address the issues of adolescent people, because this is what their government is supposed to do, but because of limited resources, government is not able to do all what it's supposed to do.
The Adolescent Development Club venues often are located in remote and logistically challenging regions or districts in Uganda.
At the health center at pre-level, we're supposed to have a youth-friendly corner that would handle really the young people and adolescents, the ELA girls. The service is not here at the health facility, and they have to walk up to Kabong Hospital 18 kilometers from here. So the ELA club brings that service nearer, because when they come to the club, they can meet their adolescent right promoter, that is the mentor. So we really thank BRAC and ELA project for bringing the service nearer. UNFPA has also done a great work funding the project. We would not be here, but because of the funder, we thank UNFPA for the service that has been supported in the community here.
Increasing availability for rural participants and even access for mentors will prove critical in ensuring the ELA program can reach as many vulnerable women and girls as possible. The COVID-19 global pandemic has also brought its own challenges to many program participants of the BRAC and gender-based empowerment arena. Many achievements made have now been impeded by restrictions on movement, school and work venue closures, and leaving many young and adolescent girls more vulnerable in the community.
We all know that the current epidemic that has struck us globally, it has also come in with its own challenges and impacts.
The lockdown prevented the girls, first of all, from meeting in their safe spaces where they could be sharing different challenges.
As a district, we realized so many cases going up with GBV cases increasing. Most girls keep themselves away from those other bad activities because they are engaged at school. So now there is no school. These girls are at large in the communities, and young boys and also the older men take advantage of that and exploit these girls. As we talk, we've registered so many early teenage pregnancies as a district. That is simply brought because of the lockdown and the pandemic. But
we've always encouraged through our mobile public address system, sensitization at different levels, that however much we have got this challenge, let's continue on going for health services.
Much as COVID brought a lot of issues, but we are coping up and we are carrying on with our club activities. And this project has helped us create awareness to these girls on, first of all, on how to take care of themselves and stay safe from COVID. We observe the remedies, that is hand washing and sanitizing, social distancing and putting on masks, and club sessions still continue because we want to keep our girls carrying on, accessing the information and staying safe.
We look at our program as being a low-cost model. It gives opportunity for the girls within the same age category to interact, to share their experiences. But then also it is so unique in such a way that it focuses on the girl herself. The girl is the center. Then we are able to link the girl to the health centers. We are able to link the girl to the district to benefit from livelihood program or the government. The girl is linked for family planning services. We see the community through community engagement.
We need to really appreciate as a district that BRAC has done a lot to improve our youth, where in the long run they will become good citizens. They will be people who have gotten their own positive way of living. If they could continue for some couple of years, I think we shall see a very good change in our community.
On behalf of BRAC and ELA program beneficiaries, would like to extend our appreciation to UNFPA for the support, without which we would not have transformed the lives of adolescents across Uganda.
We're asking for another phase to again, bring back livelihood programs, a life skill, and bring hope to the people. Because people are now, they don't know, they are asking what next.
Our ultimate goal of BRAC is to scale up ELA program in the next 5 years of operation to touch and change the lives of over 300,000 adolescent girls across Uganda.
BRAC's ELA initiative will continue to work on its bedrock of community education and participation, which in turn is aided by government collaboration and partnership. With its experienced pool of mentors, promoting entrepreneurial growth and development, coupled with the public and private sector engagement, BRAC's long-term approach and initiative is an investment that will reap dividends for a new generation of adolescent girls in building a healthier and more productive future for themselves and their communities.